image in your mind. But I was like, you're middle-aged now, Mark. I was like, I can't give you those teeth because that's not you anymore. I was like, this is you. You know, maybe not quite that, but I was like, we got to do something age appropriate for you. And I said, Mark, I promise you, this is my name that's on these teeth too. I don't want somebody to see you and be like, who's your damn dentist? I want to like get you to a point where you feel good, but it also functions well. And that's the role of the prosthodontist, right? If I can make it look good and function well at the same time, like two birds with one stone, right? So Mark agrees. He's like, all right, doc, well, I trust that you'll make me look good. So he goes in for the day of surgery. Now, I don't do surgery, right? So I go in, and the surgeon lets me, get some photos while I'm there, and we take all of the teeth out. And of course, we need an immediate denture. So for the people who are doing dentures, who does immediate dentures? Anybody here do immediate dentures? What do you think about immediate dentures? Yeah. Any challenges? Depends on how many teeth you take out, it sure does, right? So for me, immediates are, on one end, they're great because I can charge as much as I do for a denture, and it's just like a quick alginate impression ahead of time, and we're done, and that's it. The other problem that I always get is sometimes on the day of surgery, right? Like getting them to fit, getting them to stay, getting the patient to be compliant with it. So one of the things that I do, one of the big issues with immediate dentures is the healing, right? So one of the things that I do, and this goes for all of our surgery patients, who here does in-office whitening in their practice? Anybody here do in-office whitening? Okay. What is the bleach that you use? Do you know? You know the percentages?
It's higher than normal.
It's pretty high. It's about like 38%, 40%. It's probably pretty caustic, right? So what we do for all of our immediate denture patients is we put bleach in their dentures. Not the stuff that you use in office. That would barbecue you. That would like cook you. This is a 10% carbon peroxide. And if any of you guys, who here has kids again? Who's got kids? All right. So when our first daughter was 2 months old, she had thrush in her mouth. And I remember going to the pediatrician. I was in dental school. And the pediatrician said, Miles, when you go to the dental school, when you're back at school tomorrow, grab like a handful of, is it food here? You want to take a?
Whenever you're to.
All right, I'm going to show this quick video. Yeah, no, this case is really long. I'm going to show a quick video, and then we'll come back, and I'll let you guys think about that. So the pediatrician said, grab a bunch of cotton tip applicators. I want you to go to CVS or Walgreens, and there's this product called glyoxide. Go to where like the Doc Blonders, like toothpaste, like the organic toothpaste, the Orgo Fruity crappy toothpaste. You guys know what I'm talking about, right? It's like the snake oil, right? So she's like, there's something called glyoxide there. It's in a little box. It's about 20 bucks. It's a 10% carbon peroxide liquid, and I want you to dip the cotton tip applicators in there and put it in your daughter's mouth every hour on the hour while she's awake, and it'll get rid of the thrush. That is a 10% carbon peroxide. Many companies that make a 10% carbon peroxide, it's the same thing, only with carbapol in there, which is like a odorless pasteless powder that makes it turn into a gel. That product is originally designed to be an oral antiseptic, okay? So it's not, the whitening is a beneficial side effect. The whitening, the bleaching companies that have this now, it was never intended to be a whitening product. When it was out as an oral antiseptic, guess how many people bought it? None, unless you were told by your doctor to get it. In the 60s, oral surgeons were extracting teeth. They were giving their patients trays to wear with 10% carbon peroxide in there to kind of clean the wounds. Same thing with orthodontists. When little Jimmy would get his braces off, anybody ever have traditional brackets on their teeth? Anybody ever had the actual like metal brackets on their teeth? And what did your gingiva feel like when those came off? Like all marshmallowy and gooey, right? So the orthodontist would give the little kids retainers, and they'd have them wear 10% carbon peroxide in there like overnight. And then when little Jimmy would come back for his 1 month recall, the orthodontists were like, damn dude, your teeth are hella bright, they're really white. And so the dental industry realized, hey, you know what doesn't sell? Oral antiseptics. We can't get these kids to brush their teeth, but if we market it as a whitening product, they'll buy it. And then that's where like Crest White Strips took off and all of those products back in the 90s. And it became like a multi-billion-dollar industry almost overnight. So we leverage the power of the oral hygiene from this 10% carbon peroxide gel. And oh, by the way, it's super viscous, right? It stays in there. I'm hanging this thing upside down and shaking it, doesn't come out. I'm not gonna give my patient like oral gel to like hold that in, denture adhesive. I don't want to put that in a fresh wound, but I'll put peroxide bleach in there and it works just fine. So what I do on the day of surgery, I'm usually there, I'm usually present to deliver this if I have to make any adjustments to the occlusion. I will have the surgeon put this in, and I'm going to show you guys a little video now of Mark at the chair while he's getting his teeth out, and I will narrate it for you. So this is the periodontist, and I would do this with my oral surgeon as well. And I take an entire tube and I put it just horseshoe shape all the way around the arch. And now Mark is in the chair. I've already tried the denture in. I already know that it fits. I'm not going to be surprised at the time. So I already know that it fits. And you can see his tongue's still red. He's still got some blood on his lips. So now we insert it in. It's really hard. Get that in there. Have the patient close down into occlusion. I leave it in for 72 hours. Everybody's always been told, what, how long for an immediate dentures? When you take it out?